The other day, for some reason, I was thinking about survival of the fittest and survival of the most cooperative. So I looked into what His Holiness actually said, and he's probably said many things, but some things that really came to light to me to introduce this BBC I want to do have to do with universal responsibility, which has a lot to do with cooperation. And he was speaking in 1993 in Washington, D.C., and he was saying that at the end of the 20th century, we find that the world has grown smaller and that the world's people have become almost one community, which we can really experience now with the pandemic. And that people are being drawn together by the grave problems that we face. So exactly the situation we're in now. And he was saying that to meet the challenge of our times, we have to develop a greater sense of universal responsibility where each one of us, every single individual, learns to work not just for their self or for their own family or for their own nation, but for the benefit of all of humanity. And that this urgent need for cooperation can only strengthen and help humanity. He actually said universal responsibility is the key to human survival. So for me right now, this really resonates with what we're seeing is happening with COVID-19. And one example that really, I think, highlights what this could look like is the country of Rwanda, who the WHO organization has complimented on how well they've contained the COVID-19 virus, COVID-19 disease and the coronavirus. And they're a nation of about 12 million, and they've had they're not even on some of the charts. I mean, they've had about 3,000 cases and 11 deaths, which when you look at all the list of all the different countries, is like really small. So I listened to something that made me think of this. It was an interview with Ray Suarez, who is of the World Affairs Council, speaking with, get her name right, Agnes Binagwaho. So just to give a little bit of background, Rwanda in 25 years ago was basically considered a failed state. It was reeling from the genocide. There were 80,000 ethnic Tutsis and moderate Hutus that were killed within 100 days by the dominant Hutu forces. 1 in 4 Rwanda children died before the age of 5, and the average lifespan was 30 years. So we're talking 1994 or 5, I think it's 94. And then after the genocide, 70% of the remaining people were women, and they propelled the country's reconciliation process and fostered economic development. And when I looked just to see a timeline, what's been happening, I can still see even now over the last years, things haven't been super smooth in Rwanda, but the country has radically rebuilt itself. It's still one of the poorest countries on the planet. And as professor and physician Binagwaho said, many people in Rwanda live hand to mouth without any savings. You earn the money, you live on that day. And if you don't earn the money, you don't eat. So that's hand to mouth is not so unusual there. But even within that kind of situation, when they rebuilt themselves, they really did a lot to invest in universal health care. And the life expectancy has doubled. And then, they have this great success so far in terms of containing COVID-19. So just to give a little bit of background about Agnes Binagwaho, she is from Rwanda, and she's a pediatrician, and she returned to Rwanda in 1996 after getting her degrees and whatever. And then she served since then till about 2015 or 16 in high government positions in the healthcare sector. And in fact, she was the Minister of Health for 5 years, and then she co-founded a University of Global health equity, along with Partners in Health that you've talked about. And actually they're supported by the Gates Foundation, and she teaches some at Harvard Law School or Harvard Medical School. And so she's very well educated and very experienced. So I really had a lot of faith in what she said. So I wanted to present what happened in Rwanda from her perspective. She said there's a lot of solidarity because after the 1994 genocide, we all understood that this country will be rebuilt on solidarity, not on individualism. Better all go together. And here in COVID-19, it's the same. Better all go together. Those are her words. So the way she sees the situation in the world is that all the world's political leaders knew what to do to fight COVID-19, and Rwanda just decided to do that. They had evidence, it's actually the same things you told me from your experience in Singapore. Everything that she said is all the stuff that Venerable Damsho told me back when I first started following this months and months and months ago. So they followed all the evidence-based interventions that we all know about now: hand washing, testing, isolation and quarantine, contact tracing, social distancing, and depending on the situation, sometimes total lockdown, but kind of managing things in that way. And she just said everyone knew about this, but only some countries decided to do this. Like a lot of this, of course, there's a lot of details about COVID that weren't known, but a lot of the basic procedures of how to handle infectious diseases are very well known. They've been spelled out for years. And Rwanda's healthcare system doesn't have a lot of ICUs. They don't have a lot of infrastructure. So they decided to try to protect the disease from spreading in the country. And so her point of view is that all duty of all world leaders is the same. Not because your healthcare system is stronger can you just do things in a different way. Everyone, she believed, should have implemented an evidence-based intervention. So in Rwanda, they started fighting the virus months before it arrived. Their first initiative started in January, where they stopped flights and they started preparing both the borders and dealing with flights. But she said it's not enough to be ready at the airport, which is what we did only. You have to be ready inside the country. So they developed the capacity, they made sure they had the capacity to be able to test the number of people that they wanted to test. And they started informing the population. Because she said, you don't inform the people about the disease when the disease enters the country. You make sure the consistency knows its risk and what will be the reaction. So everybody's kind of on board already. So they started a national communication campaign, and they started with the churches, which is so interesting to me because the first news I really heard about was the temples and places in, it was in South Korea that really sparked my, like, wow, their first outbreaks are at the churches, and we've had the same problem, and people congregate there, obviously. So they met with all the churches and they told them the situation. They said, you might have to close, but they didn't leave it at that. They made sure that the media and the television and the resources they had like that made space for them so that they could continue their weekly spiritual endeavors. So they supported that. And then they did a lot of preparation, not just with the churches, but also then with the entire population, with the media. So they had, explain what the risks are and this and that. And of course, their population was more, as the people in Uganda, the thing I listened to about Uganda, which is next door, they weren't surprised that in the US we didn't take this so seriously because they said people forget things easily. But when you live in a country where you've had these kind of problems, you're more like on board automatically. You've kind of figured out some things. It kind of reminds me of a friend of mine who died from breast cancer. It was her first real health problem, and she didn't really know how to access healthcare in a very useful way, and it probably contributed to her death, really. So there's something in knowledge that we have, and so Rwanda was more on board. They had already had the threat of some other epidemics, and so they had already done the preparation work. But still, it took a lot of planning, because then their first case came in mid-March, the first COVID case, and they went into a national lockdown. And that took a lot of planning. And they recognized that the kind of poverty they have in their country, you can't ask people not to work, because you're just asking them to starve. So they met with the government met with the 15,000 villages, and they connected the poorest people to the new relief program that they had provided. And how did this happen? How did this relief program happen? The President of the Republic gave his entire salary of April to help the vulnerable to pass through the lockdown period. And that inspired all the governors, and that inspired the leaders, and that inspired the people in the civil society to follow suit. And all that money went in to support this program. And through that, partially through this solidarity, this is what she called that, and also partly through the national budget, they supported people through the lockdown. So they combined their lockdown with a rigorous testing program. They stockpiled the materials starting in the end of December. All the materials that you need, that they were going to need for testing, they were doing this by the end of December. So they were on top of it. So then Ray Suarez asked, he was kind of, surprised by some of this. He said, so if you tested positive for the coronavirus, what happened inside Rwanda? How were you cared for? How were you treated? How were you removed from society? That was his question. And she said, not removed from society. That's a Western definition of treatment. So right here we have this problem, No, everyone in their country already knew they had avoided Ebola, but people were ready. They knew that they have a greater chance of survival if they were taken care of by professionals rather than being on their own. So they don't have the notion of you're being removed from society. You don't remove yourself from society just to protect society, but because you're going to be helped. And not all countries have this experience with healthcare, but that was their experience. So it wasn't hard for people to then signal, hey, I think I'm at risk. And right then the person was put into a quarantine, isolated, followed up daily with clinical care, tested for free, isolated and quarantined for free. So that helped the people not to be in financial trouble. And also their attitude about this was so illuminating. It reminds me of one time I went to New Zealand. And in that time, it would have been about 1995. That's right, when I ended physical therapy school. And we were having this big debate in this country about the needles that you give, clean needles that you give to addicts so that they don't hurt themselves with dirty needles. And in this country, it was like, why are we doing this? And when I was in New Zealand, it was like, what is the government taking so long to get this program going? It was a 180-degree different attitude. And the same thing here. What she said is, some people cannot afford and will not put themselves or their family in financial trouble to support the program of stopping the spread of disease. That's a given. So you don't ask people to bear the cost of protecting everyone. That was the response. And that's what they did. It's just such an amazing thing. It's not what we did where the different companies, then the company wouldn't provide people with masks or even let them wear masks and all kinds of things that we saw roll out in the US here. That isn't how it went down in Rwanda. They put a great emphasis on testing. And then Ray asked, well, how did you do it? How did you get this testing set up? Because a lot of countries with a lot of means have had a hard time doing this. And she's so straightforward. She says, this is simple logic. If you want to know if you're sick, you just have to test. So either you want to stop the spread of the disease and you do everything that mattered to do that, or you don't do that and you don't pretend that you're trying to stop the spread of the disease. And she's also talking to, there's many countries who aren't doing testing, aren't reporting. There's all kinds of ways that things are being handled around the world. But in Rwanda, you get results in 24 hours. And then Ray Suarez was like, wow, I'm in Washington, D.C., and it would take me 5 or 10 days to get my results. And she says, tell me, You believe the equipment has to run for 5 days to get your results? This is a matter of the organization needs to be revised. So it's just, she's so pragmatic. So she said, to get a good result, the messaging from the top national leaders down to the triage nurses in the provincial clinics have to have a few things. It has to be calm, careful, and consistent. And then he changes the topic and he says, I've heard you say the pandemic is nothing more than a failure of managing an outbreak of a disease. And she kind of qualifies that, you know, he's kind of asking, is this something the world has to get used to? Because there is the concern about the conditions are such with animals and overpopulation of humans and all these kind of factors that this could happen again and again. And that's what I've read anyway. And she concurs with that, but she says, now you can't stop the spread of all of them because we don't always have all the interventions. You know, like right away, we don't have the science or whatever. But with this one, COVID-19, we stop the day we have a vaccine and a big portion of the world will be vaccinated. And she says, managing an epidemic in a place is the duty of everybody, every country. So she's convinced there will be more possible epidemics, and we need to have a kind of global solidarity around this, start to respond together so that when an outbreak happens, all the countries respond so it doesn't turn into a pandemic again. And the cost of not helping is huge, as we can see what's happening now in terms of health, deaths, and economic hardship. So I think that her idea of solidarity is very much in line with what His Holiness said about global and universal responsibility and the idea of letting go of some individualism and thinking about cooperation and caring about everyone. So that's my good news for the day.